Today we have the pleasure of meeting with Jessica Giacone. She is a registered nurse at St. Luke's Hospital here in Kansas City. Jessica, thank you for coming on. We really appreciate you taking time out of your day. As you said, you're working from home, and being able to reach out to some of these students and talk about what you do is really going to be cool for them.
Yeah, thanks for having me.
No problem. So you're a certified clinical care nurse?
I am, so my certification, I'm a certified in critical care. So critical care registered nurse is, so before I took the role that I'm currently in the trauma department, I worked in one of the ICUs at St. Luke's on the Plaza. Okay. And so I worked there for almost 8 years. And during that time, I got my certification in critical care.
Okay. What is a critical care or a trauma educator?
So in my current role, I do trauma outreach and injury prevention for the hospital. So most trauma centers that are a level 1 or a level 2 trauma center. So I know you guys are on the Kansas side. It's a little bit different. There are like KU, for example, is the only level, or I'm sorry, I think they're in Wichita, and there's a couple other level 1s, but in your all's area, KU is also level 1, St. Luke's, as well as Truman and Research are also level 1 trauma centers. So as a level 1, some level 2s, it's our duty to educate not only the other hospitals that transfer us patients, but also the local EMS agencies that work with those transferring hospitals, our local EMS, and also the public, just to do. So pre-COVID, I was doing education to the public, like Stop the Bleed course. I was holding monthly Stop the Bleed classes, and really great education, but that kind of thing, just having, doing education and outreach, building those relationships with our referral hospitals is.
Talk a little bit about that Stop the Bleed.
Yeah, Stop the Bleed is it's a national program that came out, unfortunately, after the Sandy Hook shooting at the school. It was identified that something in the trauma world, that our trauma surgeons and people that work in the ERs, we know that the number one thing that kills trauma victims is uncontrolled bleeding. It was identified that, unfortunately, some of those that died at that school, had somebody potentially been trained that was near them to stop their bleeding, they potentially could have been saved. And so it's kind of been this international actually now, initiative to teach everyone, just like hands-only CPR, teach everyone how to potentially save a life. So how to just hold direct pressure, do wound packing, and then potentially tourniquet application if you have them. But the biggest thing, we should have 1 or 2 of our hands available to be able to help, just put pressure. Sometimes it could just be as simple as that, to stop bleeding, and until somebody's able to get there, that does have the more training.
Right.
Yeah.
That's good. And so you got your BSN from UMKC, and are currently working on your master's. Is that right?
Yep, I'm working on my master's through Missouri or MidAmerica Nazarene University online. So I have 2 kind of young children, so I do that mostly in the evening. But yeah.
Right. How did you choose MidAmerica versus another school?
Partly, well, for one, I met one of the recruiters at one of a trauma education conference that I was at. They just happened to have a booth there. And so I got to talking to her, but it was also St. Luke's actually has a education fund that every employee, if you're part-time or full-time, are able to get so much money for continuing education. And so it was one of the schools that St. Luke's recognized has a working relationship with, to be able to use that money with.
Right. And so you mentioned that you were doing it online, and that was, did you choose to do that pre-COVID or?
Yeah, I did start it this past year in the fall, but even before that, it would have had to have been something that was online just because of, um,
Working
you
with
know,
family or
working full time, having little ones. My husband works, so yeah.
yeah, absolutely. I completely agree. We have two littles at home also, so both teachers and both coach, so I know what you're talking about. How does the online master's program work for people that already have their degree in nursing? How do you go about applying for that?
Yeah, so I was actually a little anxious about that, to be honest, because I graduated in 2011
Okay.
with my bachelor's degree. So it had been a while. So I was nervous that I would have to retake classes because I remembered when I was taking my bachelor's that there was like a time frame that your classes to be able to count for your degree had to be within.
Yeah.
But luckily, especially for the program that I've done and what I've looked when I had looked around at a couple different ones, most of them pretty much just look at if you're working or you already have a degree, they pretty much worked with you. So it was just a matter of I had to do like some a little lab work to it's I'm trying to think of they have a resource that they use that basically it does like a background check and does
Yeah.
like a drug test and that kind of thing for because eventually I will have a couple of clinicals, but most of the master's programs aren't really clinicals like nursing is, but that's kind of all it was, but it was pretty easy to get into.
Okay. Um, so you mentioned that you'd been working at St. Luke's for 8 years prior to the role you're in now, and so was that I'm assuming your first job after graduating with your undergrad?
It actually wasn't. I worked a little over a year at um, so at another hospital, and I actually grew up in the community that hospital's in, and I thought I would work there forever. I volunteered there in high school. I loved it. I still do, but at the time there was a lot of administrative changes, unfortunately, and it was I had started on a floor and I knew eventually I wanted to do critical care, either it work in an ER or an ICU. I was very grateful that I got the experience that I did. But at that time, I had had clinicals at St. Luke's when I was in nursing school. And so I knew the hospital and kind of their culture. And so, kind of on a whim, I was trying to stay within the hospital I had started at, but they just weren't having openings or different things going on. So I ended up just applying to St. Luke's and was able to get hired on. And
So is that one of the things that attracted you to St. Luke's then, having that familiarity with having your clinicals there?
yeah, so St. Luke's, I had clinicals there, and I knew it was somewhere that nurses had a lot of say. And with it being a bigger teaching hospital, there's a lot of uh, it's a magnet hospital. So that means, and that's not every hospital, even in the metro, is that way. So that just means that nurses do have a say. The magnet designation is actually a nursing distinction for a hospital. And it basically says that the hospital appreciates nurses, lets them have a say at the table of, changes that go on, policy changes, that kind of thing. So I knew that was the case. And also, with it being a bigger hospital, it would just be a lot more opportunity in the ICUs, seeing a lot sicker patients. So.
What kind of benefits do you see by working at St. Luke's? Like somebody would say a benefit of being a high school PE teacher is you get to play games all day. What kind of benefits do you get to see yourself having at St. Luke's?
Um, it's definitely not getting to play games with with kids, but I'm one of those that I've always wanted to be a nurse, and the kind of nurse that I've wanted to be has definitely changed.
Right.
I always used to say when I was little I wanted to be a baby nurse, and then I had clinicals at Children's, and I learned that was not really the place for me at that time. Children are great patients, but as a brand new nurse, dealing with parents was much different. But
Right.
I don't know. I think the biggest benefit is just kind of what I mentioned about the magnet designation. I really feel empowered as a nurse at St. Luke's, especially on the plaza. Our CEO from the very top, she has weekly, now with COVID, webinars that she puts out. Our CEO at St. Luke's on the plaza is a female, and it's a really, and as a nurse, and they, I don't know, just working for a hospital that is ran by females that are, the top CEO is a physician, and then ours is a nurse. They're
Right.
healthcare people. It's not just business.
Yeah, definitely.
But
Something that's very important as well. You mentioned a little bit on your daily basis about being the trauma educator and going out into the public. What's your role look like daily or weekly as a Stop the Bleed or critical care?
yeah, now it is, I'll be honest, with COVID, it's taken a big switch within myself and the role that I do. So it's a lot more virtual things just like this, doing meetings virtually, doing a lot of emails and phone calls with those EMS. We've done a lot of education, like not webinars, but different virtual education offerings.
Right.
But before that, it was a lot more of actually getting to go out to those hospitals, the smaller hospitals that are, out in the communities that aren't able to take care of trauma patients, and, working with those ERs on what education they might need, and actually getting to see them face to face and build those relationships. So this year has definitely been a bit of a struggle, but it's been a lot different.
Yep.
Look, as it has for everyone, but
right. So with a lot of medical field professionals, they deal with a lot of different types of or levels of stress from their seeing their patients or talking to their patients about what's going on in their lives. How would you, or how do you recommend people that are dealing with that type of stress or PTS from seeing that traumatic injury and dealing with the trauma? What are some things that some people do to cope with that?
yeah, I think a lot of it is finding things that bring you joy outside of your work, and really focusing on other things, other positive things outside of work. You hear that word nowadays of self-care, but truly doing things to decompress and unwind. I've been lucky. I actually met my husband when we were in school together. He's a paramedic, firefighter. So we have, are able to talk about things and kind of talk through things. But if you don't have that person at home, generally, I always found I had somebody at work too that I could talk to, and, really unwind, and what could we have done better, what could we have done different, that kind of thing. But also almost all employers within this field have EAPs, or employee assistant programs, where they have licensed counselors, and I've utilized that several times throughout my career. Even within this past year, of how the heck do I go from somebody that's used to being a fast pace, working in an ICU, to working from home at a computer and managing all of that.
Right.
So I think that's been the biggest benefit that I've seen. But yeah, just figuring out where your things are to be able to decompress. And
so as a trauma nurse, if you don't like fill in the blank, then this type of job is not for you.
Obviously blood, blood, guts.
Right.
A nursing period of, there's some people that just, unfortunately, if it's something, everybody, there's things that are gross. I still find certain things gross even after, this long being taking care of people. But, I think that's really it. But I think most people, you figure out a way to manage it
Right.
if it's something you really want to do.
What, looking back at, your 10 years of experience in it or in work now, looking back at your high school or college days, what is something that you either wish you would have known or wish you would have did that could either help you now or straight out of college?
Yeah. Um, there's several things as I was thinking about this. I think the biggest thing I used to think when I was in high school that I shouldn't get my CNA because it wasn't gonna help me get into nursing school
Okay.
necessarily. But looking back, I went to a high school that I could have gotten it for free and gotten it while I was in school, and I could have been using that to work while I was in school, and it certainly would have helped me. I think that's something that I would definitely have done. Instead, I did more of the college level classes,
Right.
which I definitely suggest because like our anatomy and physiology, for instance, really helped me with classes in college. But at the same time, I paid for their the dual
Dual credit.
dual credit. So I paid for it in high school, but it didn't go towards my nursing degree. So I wish I had looked actually at the like degree path to see if it would qualify as something. I probably would have still taken the class, but maybe just not have taken the test and paid for it in high school.
Right.
So maybe my life. But
Absolutely.
I think that was the biggest things. But also, actually, public speaking, I thought, I need to do all of the science classes and that kind of thing. But public speaking, I think, is something that I would have really benefited from had I done that in either high school or college or both. But
absolutely, especially with patients and talking with them about what's going on with their injuries. I think that's something that is highly overlooked with a lot of nursing and medical field type professions.
absolutely.
What's something that you use daily that people might not think of that helps you with your job? Like a favorite product or a
I think, of course, now in the days of COVID and everything being virtual, we're on Teams now doing this recording, but we use Teams, and I've learned how to, within our trauma department, our team of individuals, we use that daily to make our patient log of all of our trauma patients and do all kinds of different things. But I've also, more personally, I really enjoy the Google OneNote and what's the other one? I think it's the OneNote and then Google Keep are things that are online things that I like because I'm able to have it on my cell phone and pull it up, the app on there, and at my computer at work. But I think those are the biggest things. It was definitely different when I was a bedside nurse, but
absolutely. I think that is all I have for you today. I want to thank you again. Really appreciate you being able to take the time out, talking with St. Luke's, and informing our students about your life as a trauma nurse.
Yeah, absolutely. I appreciate you asking for the time.